अच्छा, मोड ऑफ इंटरवेंशन में आ जाते हैं। हेल्थ प्रमोशन, स्पेसिफिक प्रोटेक्शन, अर्ली डायग्नोसिस एंड ट्रीटमेंट, डिसेबिलिटी लिमिटेशन एंड रिहेबिलिटेशन. What is concept of the disability? The impairment is defined as any loss or abnormality of the psychological, physiological and anatomical structure or function. For example, the loss of food, defective vision and mental retardation. An impairment may be visible or invisible, temporary and permanent, progressive, regressive, and can lead to development of the skin impairment in the case of the leprosy, where damage to the nerves related to the plant resource. Disability. Because of an impairment, the affected person may not be able to carry out the certain activities considered normal for each age and sex. This inability to carry out the certain activities is called disability, defined as the restriction or the lack of the ability to perform an activity in the manner within the range considered normal for the human being. What is handicap? The disadvantages, certain disadvantages in the life and not able to discharge the application required for him play the role the expected of him is termed this handicap disadvantage for the given individual resulting from an impairment or disability that limits the prevents the fulfillment of role in that is normal depending upon the age and social and cultural factors for the individual. The examples in accident होता है तो ना disease or disorder is accident, loss of the foot, impairment and cannot walk, disability, and in an unemployment handicap. Rehabilitation, the combined coordinated use of the medical, social, educational and vocational measure for training and retraining the individual to the highest possible level of functional ability is called rehabilitation. Classified as medical rehabilitation, restoration of function, vocational restoration of the capacity to earn the livelihood, social rehabilitation for the restoration of family and social relationships, and psychological rehabilitation, restoration of the personal dignity and confidence. Now comes the epidemiology, the mortality rates and ratios. Crew death rate is the number of the death during year per the mid-year population multiplied by 1,000. Probably the total number of the patient lived after 5 years and total number of the patients diagnosed or treated multiplied by 100. Standardized mortality rate is observed death but expected death multiplied by 100. Incidence, number of new cases of the specific disease during a given time period by population at the risk during that period multiplied by 1,000. Specific attack rate, the number of new cases of a specific disease during a specific time interval by total population at risk during the same interval multiplied by 100. Prevalence, by point prevalence and period prevalence. Point prevalence, number of all the cases old plus new of a specified disease existing at the given point in time multiplied by 100 by estimated population at the same point in time. And point in time की जगह हम period of the time कर देंगे तो period prevalence आ जाएगी. Two most important type of the study designs. Design of a case control study in which the time goes forward and direction inquiry is backward, and it starts with the cases people with disease and controls people without disease and goes back to exposed, non-exposed, exposed and non-exposed from the population. ठीक है ना. Now design of the cohort study in which the time goes forward and direction inquiry is forward in the time, and first of all the population goes toward the people without disease, and then comes the exposed and then disease or non-disease. Case control study, often called the retrospective studies, a common first approach to test the causal hypothesis, the permanent method of the epidemiological investigation. Three main features, and both exposure and outcomes have occurred before the start of study. Study proceeds backward from effect to cause, and it uses the control or the comparison group to support and refute a interference. Definition हम ये है कि the units is the individual rather than the group. The focus is on the disease or some other health problem that has developed. ठीक है ना. नॉन कंफाउंडिंग फैक्टर्स है, इनको कंपेयर किया जाता है किसी कंट्रोल को, such as age, sex, occupation and social status. The question asked related to the personal characteristics and resident exposure which may be responsible for the condition studies. For example, one can use a case immunized children and use a control immunized children. Look for the fact of the interest in their past. Used in the effectively for the study of these many cancers and the serious conditions such as cirrhosis, liver, lupus, एथमेटोसिस एंड कंजेस्टिव हार्ट फेलियर. इसका स्टडी डिज़ाइन ये है कि हम क्या नाम कि इस कंट्रोल्स को एक मतलब कि एक उसमें डालते हैं ABCD में, और सस्पेक्टेड को हम प्रेजेंट और एब्सेंस में डालते हैं. इस तरह 2x2 टेबल बनता है. इसके जो स्टेप्स हैं वो ये हैं. सिलेक्शन ऑफ केसेस, कंट्रोल को सिलेक्ट करेंगे, मैचिंग करेंगे, उनकी मेजरमेंट ऑफ एक्सपोजर करेंगे, एनालिसिस एंड इंटरप्रिटेशन कर देंगे. हम कहते हैं कि रिलेटिव लिस्ट क्यों नहीं निकालते हम केस कंट्रोल स्टडी में से. A typical case control study does not provide the incidence rate from the relative risk can be calculated directly. So हम क्योंकि ना अप्रोप्रिएट डिनोमिनेटर है ना पॉपुलेशन एट रिस्क है, तो हम क्या नाम है कैलकुलेट दिस रेट्स को करने के लिए हम नॉर्मली कोहॉर्ट स्टडी भी यूज़ करते हैं. इसलिए हम इसमें ऑड रेशियो मालूम करते हैं जो कि ACAD/BC के बराबर होती है. एडवांटेजेस क्या हैं इसके. रिलेटिवली इजी टू कैरी आउट, रैपिड एंड एक्सपेंसिव होता है, रिक्वायर कंपेटिटिव फ्यू सब्जेक्ट्स एंड पार्टिकुलरली स्टेबल टू इन्वेस्टिगेट रेयर डिजीज. अच्छा, नो रिस्क टू सब्जेक्ट, अलाउ द स्टडी ऑफ डिफरेंट एटियोलॉजिकल फैक्टर्स, स्मोकिंग, फिजिकल एक्टिविटी एंड पर्सनैलिटी करेक्टर्स in the myocardial infarction. For example, risk factors can be identified, no attribution प्रॉब्लम्स, एथिकल प्रॉब्लम्स मिनिमम होती हैं इसमें. डिसएडवांटेज क्या है कि मेमोरीज और पास्ट रिकॉर्ड्स के ऊपर भी बेस करता है, जिसकी वजह से अनसर्टेनिटी होती है. सिलेक्शन ऑफ एन appropriate control group may be difficult. We cannot measure the incidence and can only estimate the relative risk. ठीक है ना. And do not distinction between the causes and associated factors. No substitute to the evaluation of the therapy of prophylaxis of disease. And the major concern is the representative of the cases and controls. Comes the cohort study, एक analytical observational study है जिसमें additional evidence or support existence of the association between the suspected cause and disease हम ढूंढते हैं. इसके फैक्टर्स क्या हैं कि ये prior to the appearance of the disease investigation होता है. The study groups to observer over the period of time to determine the frequency of the disease among them. Study proceeds forward from the cause to effect. Concept can defined as the group who share the common experience within the defined time period. Research like that disease yes or no ABCD में आ जाते हैं, और एक्सपोज और नॉन एक्सपोज जो होते हैं वो फर्स्ट टेबल में आ जाते हैं. एडवांटेजेस के हैं कि selection of study subjects, obtaining data on exposure and selection of the comparison group, follow up and analysis. इस पे हम relative risk मालूम करते होते हैं, A/A+B multiplied by C+D/C. पेयर कर सकते हैं. proceed from effect to cause, from cause to effect, start with disease, start with the people exposed to the effect and suspected cause, suspect more frequently in those disease than among those without the disease. This tests whether disease occur more frequently in those exposed than in those not similarly exposed. Usually the first approach to the testing of a hypothesis useful for the exploratory studies is that for the testing of these precisely formulated hypotheses involves a larger number of these subjects, is relatively quick results, long follow-up period often needed involving the delayed results suitable for the study of the rare disease for the in a period when the disease were under the investigation are rare and generally yields only the estimate of order or yields the incidence rate RR as well as AR. और रेशो देता है ये, और रेशो को हम रियलिस्टिक भी कर सकते हैं, एस्टिमेट कर सकते हैं. कैन नॉट yield the information about the disease other than the that selected, but it yields information about the more than one disease and outcome. Relatively inexpensive होता है, ये expensive होता है. Herd immunity describes the type of immunity that occurs when the vaccination of portion of the population provides the protection to the unprotected individual. Herd immunity proposes that in disease passed from the individual to individual, it is difficult to maintain the chain of the infection when the large number of the populations are immune. The higher the number of the immune individuals, the lower the likelihood that are susceptible people will come in contact with infectious disease. Immunological barrier provide करती है For example, when infectious disease introduced in a region, population with a low or non-mutant tax, and the case fatality rate tends to be very high, involving the particularly also susceptible, as had happened in the very severe measles epidemic in the Far East Land. Elements which contribute to the herd immunity are occurrence of the clinical and subclinical infection in the herd, immunization of the herd structure. It's never constant. It's subject to the constant variation because of the new birth, deaths and population mobility, and ongoing immunization will keep up the herd immunity at a very high level. Herd structure includes not only the host belonging to the herd species but also the business distribution of alternative animal host and possible infectious factors, as well as those environmental and social factors that will favor and inhibit the spread of the infection from the host to host. The proportion of the immunity individuals in the population above which a disease may not longer persist is herd immunity threshold. Its values varies with the virulence of the disease, the efficacy of the vaccine, and the contact parameter of the population. Immunity may be determined by the serological surveys. Types of immunoglobulins. First of all, the IgG इम्यूनोग्लोबिन है, ये सबसे ज़्यादा होते हैं, 80% होते हैं. उसके अलावा इनका मेन काम होता है कि इम्यूनोग्लोबिन पैदा करना अगेंस्ट द बैक्टीरिया, वायरल एंड टॉक्सिक एंटीबॉडीज़. एंड इसकी हाल लाइफ होती है 21 डेज़ होती है. और IgM आते हैं, वो 6% होते हैं, उनकी हाफ लाइफ होती है 7 डेज़. और ये होते हैं रीसेंट इन्फेक्शन को वो शो करते हैं. IG जो होते हैं वो 13% होते हैं. ये मोस्ट ऑफ दी बैक्टीरियल में रिपोर्ट किए जाते हैं. म्यूकोजल पोसी मतलब कि जो है ना बॉडी सीरम्स, बॉडी स्क्रीशंस में सलाइवा, मिल्क, कोलोस्ट्रम एंड टीयर्स एंड अदर ब्रोंकियल सिक्रीशंस में पाए जाते हैं. और ये क्या नाम डिफेंस मैकेनिज्म होते हैं म्यूकस मेम्ब्रेन का अगेंस्ट द लोकल इन्फेक्शन. IG भी और इनकी होती है 6 to 8 डेज़ हाफ लाइफ होती है. IG होती है इनकी हाफ लाइफ 2 डेज़ होती है. और मतलब कि ये बहुत कम पाए जाते हैं, 0.005 मिलीग्राम पर 1 मीटर मतलब कि एक उस पर पाए जाते हैं, बहुत कम पाए जाते हैं, ठीक है ना. और इसकी IgA एक्सटर्नल सिक्रीशन में पाई जाती है. और ऐसे इन्फ्लेक्टिक शॉक को, हाइपर सेंसिटिविटी को शो करते हैं. IgD जो है ना, ये जो है IgD ये एक्ट एज एंटीजन रिसेप्टर्स के तौर पर काम करते हैं. और इनकी हाफ लाइफ 2 डेज़ है. स्क्रीनिंग टेस्ट इसमें मोस्टली मतलब कि हम फार्मूलाज याद रखते हैं. सेंसिटिविटी का है, आर्स के तौर पे याद करते हैं, A/A+C मल्टीप्लाई बाय 100. स्पेसिफिटी दब देना, T+B+T मल्टीप्लाई बाय 100. प्रोडक्टिव वैल्यू ऑफ अ पॉजिटिव टेस्ट A/A+B मल्टीप्लाई बाय 100. प्रोडक्टिव वैल्यू ऑफ अ नेगेटिव टेस्ट D/C+D मल्टीप्लाई बाय 100. परसेंटेज ऑफ द फॉल्स नेगेटिव C/A+C 7 से मल्टीप्लाई बाय 100. एंड परसेंटेज ऑफ द फॉल्स पॉजिटिव B/B+T मल्टीप्लाई बाय 100. हाइपरटेंशन की 2 टाइप है, प्राइमरी एसेंशियल एंड सेकेंडरी. प्राइमरी इज ड्यू टू अननोन कॉज एंड जो सेकेंडरी है ड्यू टू द सम कॉज. सेकेंडरी कॉज सच एज द ट्यूमर्स, एडिनल ग्लैंड्स का डिजीज ऑफ किडनी, क्रॉनिक ग्लोमेरुलोनेफ्राइटिस, पेरिनेफ्राइटिस वगैरह. एग्जांपल हम रूल ऑफ हाफ के जरिए मैक्सिमम प्रॉब्लम को हम वो असेस करते हैं. एंड hypertension is an iceberg disease. It became evident that in the early 1970s, only about the half of the hypertensive subjects in the general population of the most developed countries were aware of the condition. Only about half of those aware of the problems were being treated. Only about half of those treated were considered adequately treated. Illustrate the situation. This is the way of the illustration, and this is the way of the criteria of this illustration. Matlab from 1 to 9. And if this was the situation in the country with the highly developed medical services, in developing country the proportion treated would be far more to less. The risk factor of the hypertension, the non-modifiable risk factors are age, sex and genetic factors, and the modifiable includes the obesity, salt intake, saturated fat, dietary fibers, alcohol and heart rate, and physical activity, environmental stress, socioeconomic status and other factors. Now, what is family planning? A way of thinking and living that is adopted violently upon the basis of the knowledge, attitude, and responsible decision by the individual and couple in order to promote the health and welfare of the family group and thus contribute effectively to the social development of the country. इसके मेन जो है ना प्रैक्टिसेस certain objectives हैं to avoid the unwanted births, to bring about the wanted births and regulate the interval between the pregnancies, to control the time at which the birth occurs in relation to the age of the parents, and to determine the number of the children in the family. What are eligible couples? Eligible couples refers to currently married couples wherein the wife in the reproductive age, which is generally assumed to lie between the age of the 15 and 45. At least 15 to 150 to 180 such couples per thousand population in India. What are target couples? It's important questions. What are target couples? The term target couples was applied to the couples that had 2 to 3 living children, and family planning was largely directed to such couples. Contraceptive spacing methods, barrier methods, physical, chemical, and combined methods, intrauterine devices, hormonal methods, and post-conceptional method, and miscellaneous. And terminal methods include the male and female sterilization. Method includes condoms, female condoms, diaphragms, and then comes the vaginal sponges. And chemical method includes the foams, creams, suppositories, and soluble films. Devices, types of intrauterine devices: non-medicated and medicated ones, first generation, second generation, and third generation. These are all type of the intrauterine devices: lipis loop, first generation, and copper T200 and copper 200 and copper 200, copper 7 and copper 200. It's second generation, and third generation includes copper T380 and copper T220C. First generation includes the lipis loop, which is here lipis loop and like spring like, and second generation includes the copper devices. Earlier devices are copper 7 and copper T200, and variants are copper T220 and 380A and AG, and Nova T, and multi-load devices, multi-load copper 250 and 375. And advantage is low expansion rate होते हैं, lower incidence of the side effects, easier to fit in the nulliparous women, better tolerated by nulliparous women, increased conservation and effectiveness. And third generation are progestersert and lenogestral. Pneumoconiosis includes all the disease that are due to dust in the size range in health, producing the variable period of exposure. Lung disease pneumoconiosis will generally reply man by reducing the working capacity of the lung, fibers, and other complications. Chemical composition of these are very harmful. Like silicosis is a major cause of the permanent disability and mortality caused by the inhalation of dust-free silica dioxide. Okay. And snowstorm appearance in the lung comes, and its diagnosis criteria. Then comes the anthracosis to be due to the coal miners pneumoconiosis disease, and lives as a simple pneumoconiosis which is associated with a little ventilatory impairment. Includes the require the 12 year of the work exposure of its development, and second phase is characterized by the progressive massive fibrosis, byssinosis, determination of cotton fiber, dust fiber over the long period of the time. Then comes the bigasosis, due to the compression of the lungs by the inhalation of the bigas and the sugar cane dust. And because this is due to the thermophilic actinomycete, for the name thermoactinomyces carry was suggested 18. The symptoms consist of the breathlessness, cough, hemoptysis, and slight fever, and initially there is acute diffuse bronchitis. And dust control is personal protection, medical control, Bex's control, and these are all the preventive measures. Asbestosis, due to the asbestos inhalation, certain fibrous materials and such magnesium, iron, and Silicates of the varying composition class combined with such bases magnesium, iron, aluminium, especially types serpentine, chrysolite variety, and amphibole type. 90% of the word production of the serpentine variety, which is hydrated magnesium silicate, and the amphibole type contains little magnesium. The amphibole type occurs in different varieties: crocidolite blue and omosite brown, and anthophyllite white. Okay. mm, as per the commercial name given to certain types of fibrous material, these are silicates of the various compounds: magnesium, iron, calcium, and sodium and aluminium. Okay, these causes the ground glass appearance in the x-rays, and most prominent may consist of the use of the safer types of the asbestos, chrysolite and amosite. These are two good asbestos is इनकी सब्सटीट्यूशन करके, रिगरस टेस्ट कंट्रोल करके और पीरियडिक एग्जामिनेशन ऑफ द वर्कर करके हम सेट कर सकते हैं. फार्मर्स लंग्स क्या होते हैं? उनके फार्मर लंग्स ग्रेन डस्ट की वजह से होता है, माइक्रो पोरिस्पोरा फैनी की वजह से, एक्टिनोमाइसिटी या थर्मोफिलिक इसकी वजह से होता है, ये इंकरेज करता है ये. ठीक है ना. ये लेग पॉइजनिंग क्योंकि एंटी करसिव होता है, लो बॉइलिंग पॉइंट मिक्स विद अदर मटेरियल्स, वैरायटी ऑफ दी इस प्रॉपर्टीज यूज होता है क्योंकि लो बॉइलिंग पॉइंट होता है, अलॉय बना देता है, साइड से एंटी करसिव होता है. अच्छा, इसमें इनहेलेशन, इंजेक्शन एंड स्किन इंजेक्शन कराते हैं, ये मोड ऑफ एब्जॉर्प्शन इसकी है. बॉडी स्टोर्स में पाया जाता है और दूसरा डिस्ट्रीब्यूशन इन बॉडी मुख्तलिफ किस्म की मतलब कि शो करता है. क्लिनिकल पिक्चर ये है कि स्टिपलिंग ऑफ रेड ब्लड सेल्स, एनीमिया, रिस्ट ड्रॉप एंड फुट ड्रॉप एंड ब्लू लाइन ऑन द गम्स ये शो करता है. एपिटाइट भी यूज़ करता है, एपिटाइट में की भी लॉस करा देता है. ठीक है ना. क्लिनिकल फीचर्स की हैं कि हम इसमें मतलब कि लॉस ऑफ एपिटाइट होता है, इंटेस्टाइनल कॉलिक, परसिस्टेंट हेडेक होता है, और क्या नाम है, कॉन्स्टिपेशन, जॉइंट्स, मस्कुलर प्रॉब्लम होता है, ब्लू लाइन ऑन द गम्स, अनीमिया. अच्छा, टेस्ट क्या होते हैं? कॉर्पोरफिन का टेस्ट होता है यूराइन में, दूसरा होता है अमाइनो लिविनिक एसिड इन द यूराइन. इन तो ये टेस्ट तो मस्ट है. ठीक है ना. इसी पर स्क्रीनिंग होती है. अच्छा, उसके अलावा लेड की ब्लड के अंदर जो होती है और यूराइन के अंदर मिकदार होती है उसको देखते रहते हैं. दे प्रोवाइड क्वांटिटेटिव इंडिकेटर्स एक्सपायर. अच्छा, ब्लड लेवल, बेसिकली स्टिपलिंग ऑफ दी आरबीसी भी हम देखते हैं. कैंसर इंक्लूड द स्किन कैंसर, लंग कैंसर, कैंसर ब्लैडर एंड ल्यूकेमियास. Absence is important health problem in the industry. Serious impaired production with the serious cost and repercussion, both direct and indirect. As the production techniques become more sophisticated, absence leads to the increase the adverse expression. Absenteeism is the useful index necessary to assess the state of the health workers in their mental, physical, and social well-being. It's the sickness leave that is important in the working criteria. Function of the occupational disease. Medical measure replacement examination, periodical examination, medical and healthcare services, notification to authorities, supervision of the working environment, maintenance of the analysis records, health education and counseling करते हैं. engineering में इसमें design, building, good health, housekeeping, and then general ventilation and mechanization, substitution, dust and enclosure and isolation करते हैं. local exhaust ventilation करते हैं. protective devices, environmental monitoring and statistical monitoring and research कराते हैं. legislation में ये है कि the most of the plans are in the favor of the workers, not and the such laws are made which are very useful for the workers. इसमें फैक्ट्री एक्ट 1948 एंड इन्फॉर्मेंट स्टेट इंश्योरेंस एक्ट इंडिया का 1948 मशहूर है. What is planning? Health planning. Develop, analyze, and gather health data, formulate the health problems, assign and priorities, and among the problems, formulate individual priorities, problems for the planning, solution, define programs and objective and how to measure the achievement, assign priorities among the objectives, design alternate programs to solve the problems, select best program, feasibility, cost and effectiveness, combine the program, develop the integrated plan, and plan implementation, orient and train, and initiate the integrated program, operate program, collect data for the evaluation, evaluate the results and goals achieved. If not formulate the health problems, and if yes, then goal satisfactory, then operate the program. This is the health planning.